Okay, let me get my notes up. Hello, everyone. Welcome to our podcast. I'm Alicia Swami, and I'm here with Eric Johnson, and we are exposing molds. Today, we have Dr. Shaher Khan. I'm sorry, did I say that right?
Shaher Khan.
Shaher. I'm so sorry. My God, I don't know why. I want to say something else.
No,
Okay.
no, no worries. Everyone says it. It doesn't
I
matter. I'm
don't
used to
want to
it.
be
That's fine.
disrespectful to you.
Sure,
Today
sure.
we have Dr. Shaher Khan with us. Dr. Khan is double board certified in plastic and reconstructive surgery, as well as general surgery. He is a breast explant specialist and implant illness advocate who has spent his fellowship training for plastics and reconstructive surgery at the renowned Detroit Medical Center. He has received many honors and awards and is a published surgeon. Currently, he is owner and founder of Executive Plastic Surgery in Novi, Michigan. In addition, Dr. Khan uses his YouTube channel, Khan Plastic Surgery Academy, to educate patients and fellow physicians alike. Thank you for joining us, Dr. Khan.
You're welcome. Thank you very much for having me. And it's a pleasure to talk to you in regards to what is a very important topic, breast implant illness. And as you will see, when you look deep into this topic, it is very real. It is a real problem. And as you will see, a problem that has been identified by the FDA and also now by the many rheumatologists and family medicine doctors and the patients themselves who have taken ownership of their own health and sought solution to this very serious problem.
Awesome. Thank you for that. I just want to tell you a little story before we get started. So, I have been obsessively looking for a surgeon to talk about breast implant illness and explants. And honestly, I've had zero luck with anyone being interested in coming on our podcast to discuss the subject. So I took to Facebook groups and I found that you run a support group on Facebook about this subject. So do you think the reason why people don't want to talk about this is because it's such a new thing that people are seeing in this industry? Or what do you think is going on?
So the vast majority of the plastic surgeons, if there's 8,000 of us board certified by the American Society of Plastic Surgeons, majority of us do not want to believe in breast implant illness. The belief or the general notion is that these are the cohesive, safer, newer generation, what they call the gummy bear implants, and that these are certainly safer, better, ever since the ban in 1992. And when they were reintroduced in 2007, the convention or the general notion is that these are safe devices. And that basically they are not associated with what is the breast implant illness. Now, what I direct my patients and anyone who's listening is to let's look at the facts, what we know of, what the manufacturers themselves put forth in their basically studies, and you will see very clearly that this is a real problem. And as I mentioned earlier, this is a real problem with a real solution. So the many plastic surgeons do not want to believe in it, unfortunately, simply because they feel within their mind from what the research has shown. Now, there is, again, ample evidence that proves otherwise.
Wow.
Obviously, there is, and I will say this very boldly, there's obviously a financial interest as well, right? This is the most common plastic surgery procedure that was done by the plastic surgeons. Not anymore. It used to be the number one breast augmentation with silicone and or saline implants used to be the number one operation that the plastic surgeons used to do. Now, ever since COVID, and then obviously more and more of an awareness, less and less of the augmentations are being done. Now, it is, if you look at the FDA warning from a couple of years ago in October, where they clearly, the FDA said this: if you're a plastic surgeon who is talking to a patient and who is interested in augmenting, be it for cancer, oncologic reasons, or cosmetic reasons, the plastic surgeon must sit down and discuss with the prospective patient these three facts. Fact number one, that the implants are not meant to be in the body forever. Number two, that they're associated with breast implant illness, which is the many sign symptoms, constellation of sign symptoms of what is brain fog, fatigue, joint pain, rheumatological problems. And third, that the breast implants are associated with breast implant associated anaplastic large cell lymphoma. And these are the three things that the surgeon has to discuss. Now, if you can imagine, if you're a prospective patient who's interested in getting implants, if I just tell you this alone, you should easily be able to make a decision and say, well, I don't want something in me that is not lifelong, to the point where I'm going to put you on hold and I'm going to get the journal just right now.
Sure, we can, with the power
Sure.
of editing, we could.
Sure. No, I want you to see this, and it's important. So if you see, this is the mentor ad, right? And I can give you a copy so you can put it. Now, half of the ad itself talks about natural feel, and I put down danger on top. Now, I'm going to read right now. This is the #1 journal that the American Society of Plastic Surgeons puts forth. Look at the warning, if you will. Warning, and I'm going to read it out to you.
Sure.
Word for word quote. Warning, breast implants are not considered lifetime devices, period. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. So 10 to 15 years is what they say. I say 7 to 10 years. The second thing they mentioned, and remember, this is the manufacturer, the mentor ad in the journal itself. #2, quote, breast implants have been associated with the development of a cancer of the immune system called breast implant associated anaplastic large cell lymphoma, BILCL, period. This cancer occurs more commonly in patients with textured implants than smooth implants, although rates are not well defined, period. Some patients have died from BILCL. And now point #3, patients receiving breast implants have reported a variety of symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others, period. Individual patients' risk for developing these symptoms has not been well established, period. Some patients report complete resolution of the symptoms when implants are removed without replacement. Now imagine, these are the points that the plastic surgeon has to discuss. Now this is a warning that's required so that they have to be able to advertise this in any journal. Now guess what? It doesn't stop there. It tells you breast implant surgery should not be performed in women with active infection. #2, with existing cancer or precancer of their breast who have not received adequate treatment for those conditions. How many breast cancer patients do not know if they have lymph nodes that are positive or negative, if they're going to get radiation or not, right? You don't want to get radiation on a chest that has received implants, correct? And then look what it says over here. Breast implant surgery should not be performed in women who are currently pregnant or nursing. Now, are you saying how many women who get implants and then eventually get pregnant? Because according to this is a red flag. Then they mention, again, this is all in the ad. You can see this on my Facebook page that I've posted. Patients with a diagnosis of depression or other mental health disorders should wait until resolution or stabilization of these conditions prior to undergoing breast implant surgery. And then not only that, it says over here, the health consequences of a ruptured silicone gel breast implant have not been fully established, period. MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect for silent rupture. Now, I will tell you this. This is in the advertisement, and I can send it to you so you have it. You can post it. Now, I'm not trying to scare you. I did not make this up. This is the manufacturer itself. Now, not only that, look at Natrel. This is at the front cover. The same warning is on the inside. Now, I just read to you, if you have a person with an open mind who says, I want to get breast implants, be it after breast cancer or cosmetically, I will tell you, any person with any reasonable mind, and I use the word very bluntly, if you tell, now we live in the Motor City here in Michigan, right? If I tell you I have a car that might break down in 7 to 10 years, might literally just stop running in the middle of the road, i.e. get cancer, or it basically will be associated with transmission axle problems, i.e. the BI symptoms, or you have to get it checked every so often. I will tell you, you're not going to even look at the car, right? And the point I'm trying to make here is breast implants are not safe devices, even the newer generation ones. If, let's say, there was even a suggestion about a pacemaker, right, or a hip implant that was going to be related to all these problems, I assure you no one's going to get the hip implant, right? Same thing, implants are dangerous, be it saline or silicone, and the rate of rupture is there. Last week I did a case, this lady had implants that were ruptured at the 7-year mark when she came to me, where I removed the implant. And who knows, could have been ruptured for a year or two, maybe 6 months. And this is the problem that we're dealing with. Implants, the newer generation, the cohesive, are not safe. They're replete with problems. Eventually, I use the word 100% of the patients are going to get breast implant illness, because remember, it is a matter of time before the implant ruptures. And when the silicone toxicity occurs, this is the breast implant illness where the silicone leaches out, usually from day one at times. And now the patient has all these autoimmune rheumatological problems, fatigue, brain fog, and from the hair follicles, hair falling off, to the dryness of the eyes, migraine, psych problems, including emotional instability, depression, anxiety, neck, back pain, clearing of the throat, sinus problems, neck and back pain, chest pain, irregularity, contracture, infections, not being able to palpate on a self-monthly breast exam for what is breast cancer, right? Remember, 1 out of 8 or 9 women are going to get breast cancer, and now because of the big implant, they're not going to be able to palpate their breasts, and now breast cancer is going to get missed, or they may be reluctant to get a mammogram. Cardiac issues, arrhythmias, palpitations. You have patients with blood pressure problems, GI issues, rheumatological problems, like I mentioned, GI disturbances, and again, the fibromyalgia type symptoms, endocrine problems, and almost all organ systems of the body. Not all the time, but in majority of the cases, it will come and go, or it may touch on an organ system. And this is where the problem is real, and this is a real problem.
So why are you so passionate about this? Like because it sounds like a lot of surgeons are just turning a blind eye and they don't want to admit that this is an issue. What has been driving you and your passion within this and becoming an advocate for women who are falling ill from breast implants?
So number one, when I saw this very early on, when I was a medical student and I saw the many patients, I said, do no harm. That's the oath I took. I know myself, when I finished, I could have easily augmented. I chose not to augment. This is when I first got out of medical school, and then I finished my 10 years of residency training, which is 5 years of general surgery, 2 years of burns, and then 3 years of plastics. That's almost 100 hours a week. And you're in so much debt. For example, the easiest answer is, let's go ahead and get started the augmentation, because that is where, and I said to myself, I'm not going to do something that I do not believe in. And I saw patients after patients with ruptured implants, and I said I was not going to feed my family, and I was not going to do something that I truly did not believe in, to the point where I was working primarily out of the emergency room. I used to sleep at 3, 4 in the morning. I used to be going from one dog bite in the emergency room to doing, and I was very busy from week one, but I said to myself, I'm not going to do this elective procedure where it is the quickest buck for the time that you spend in an hour. This is how long it takes to augment. And for me, I did only one case in order to get board certified. And now for someone where I chose not to touch even the breast implants, now my whole practice exclusively, 99% or more, is devoted exclusively to explantation, and in a manner that I do such that the patient can remove the entirety of the implant, plus the capsule that's around the implant, plus any inflamed tissue, such that there is no inflammatory burden left behind. And that, most importantly, the patient has the capsule analyzed to make sure it's not lymphoma or the squamous cell cancer that the FDA just like 10 weeks ago mentioned in October, in September, that there is a new type of squamous cell cancer, and that we rule out bacterial infection or fungal infections. I send cultures off for aerobic, anaerobic, and fungal, and I always return the implants to the patient. And whenever I am, quote, cleaning out the chest, if you will, which means removing all inflamed tissue, even the slightest doubt if it is inflamed or not, I will remove it, because I do not want that inflammatory burden to be left behind, such that the patient gets the best chance to bounce back to a normal state of good health. And you will see patient after patient, well over 90% of them, look at this. I'm going to read this again. This is very important. Some patients report complete resolution of symptoms when the implants are removed without replacement. And the answer here is you have to remove the capsule. And I'll tell you, more than 90% of the patients will seek relief from their many signs and symptoms of breast implant illness. Now,
Fantastic.
one thing I want to mention, when I started, it was very easy for me to do so. I talked to some of my friends. They're like, how come you're augmenting when you know the detrimental effects, because you've seen so many patients with ruptured implants and the many problems that they came in with? Forget that. Just look at the 1992 ban. We have the same set of problems, the silicone toxicity, the same set of problems that the current patients are presenting with. And some of us surgeons, especially the senior ones, have already gone through this phase where they were banned, i.e. the silicone implants, and now we're going back into what is history repeating itself. And I just want to emphasize, the saline implants are as bad as the silicone, and certainly as bad as the ruptured silicone. So all of these implants, i.e. both saline and silicone, are bad. They are associated with the same set of problems. I cannot look at a patient and state, or because of her symptoms, she's got saline, or because of her symptoms, she's got silicone. They could indeed be both interchanged, and you would not know which one has what.
Do you see thickening of the capsule that correlates to the strength of the immunological response?
So that's a very good question. I see patients with a capsular contracture, which is thickening of the capsule, in patients who have saline implants, maybe just from 6 months ago. And so these patients react. One may have grade 4 contracture with a capsular contracture and thickening of the capsule, and the other side is normal with a good aesthetic result. And majority of the times we do not know why thickening occurs on one side versus the other. Now we know that if there is a biofilm, or if there is maybe a bacterial contamination during surgery, or maybe majority of the times we do not know why a capsular contracture would occur on one side versus the other. So there is no true correlation. I have seen patients with thin, what I would say very average, benign looking capsules. Once the implant has been removed along with the capsule, they have complete resolution of their symptoms. And so there is no true correlation between the thickness of the capsule and their immune response and their relief of their presentation of the breast implant illness symptoms.
Do you see a consistent fungal or bacterial colonization that associates?
Yes. Yeah. So I would say, so every single patient I have sent, maybe except for 3 patients, these were Canadians or patients with no insurance, and they chose not to proceed with pathology. So almost every single patient I sent to pathology, and then I sent to microbiology for aerobic, anaerobic, fungal. So to date, I have had 3 patients with active mold infection. 2 of these patients, I always, whenever I see any mold, I always send these patients along with the microbiology report to the infectious disease doctor so that they can officially see and treat the patient, because this can sometimes be very comprehensive and very detailed. And I'm not an infectious disease doc, so that they can tailor the treatment accordingly. So 2 out of the 3 patients who had mold, the infectious disease doctor said, well, the foreign body is out, your exam is unremarkable. They did blood cultures in their routine, and their exam was essentially not suggestive of an active infection. 1 out of the 3 patients, she actually had an active infection and she needed to be treated for 8 months with antifungals, and she was actively followed by the infectious disease doctor. Now, this is fungus. The bacterial colonization and cultures have come back positive almost on 15% of my patients, where you have Cutibacterium acnes, that's being the most common. And there are other groups, other plastic surgeons who have reported this likewise, where Cutibacterium, that's cutie means skin, bacterium, acne meaning acne, for example, that may have seeded the implant. And remember, anything foreign body, it is very quick to pick up on what may be in the bloodstream or in the proximity of the implant. Any bacterial, be it the hair folliculitis, for example, seeding the implant, for example, or skin flora, or maybe it was supposed to be a no-touch technique when the plastic surgeon introduced the implant into the chest through the Keller funnel, but somehow there was contamination. So 10 to 15% of the time, and I've seen this in literature, there is similar findings by other surgeons who take cultures that indeed this is what I would say is a benign finding. I use the word benign, meaning non-surgical management. Now, in my practice, I'm happy to state that I've had 0 cellulitis infections. I give my patients a dose of antibiotics through their IV 1 hour prior to the surgery, which is according to the criteria, any surgical standard of care across the US, just like after any breast surgery. And then I give them antibiotics, preferably Keflex for the skin flora, 500 milligrams, 1 tablet every 6 or 8 hours, depending on their profile, for 7 days. And this, I have seen in my practice, has certainly led to what would be a 0 post-operative cellulitis. And so these are this is the breakdown of the microbiological findings in my patients.
How often do people have problems because of ruptures compared to just strictly becoming ill from the presence of the implants?
Very good question. There are patients that I have seen in my practice who have had implants. Let me give you the example. I have a 22-year-old lady, 2.5 weeks into her augmentation, she started developing GI issues, fibromyalgia, tingling, numbness in the arms and legs, and I actually did a Facebook Live with her. I saw her emergently in my clinic, and the very next week, I put her on the OR schedule. At day 29, I operated on her, and she had not developed the capsules at that day 29. And she had what was almost complete resolution of her signs, symptoms of breast implant illness this early on, just within the 29 days that she had the implants. There are patients that, now fact, if you look at any study, the rate of rupture, now look at this Mentor ad. It tells you right there, the manufacturer is telling you, if you have an augmentation, gel implant, silicone implant, and let's say time 0, year 3, you need to have your first MRI. And then every 2 years there onward, you need to have an MRI to look for a silent rupture, meaning the patient's sitting around like talking, walking, and routine day-to-day activities, and she could have a silent rupture, meaning she is sitting on what is a rupture. You would think the body in itself would form a thicker capsule or would be in pain or would alert the patient that something is wrong. No, these are silent ruptures. And that's why MRI screenings are being recommended by not only Mentor, but FDA. Now, fact number 2, if you look at the studies of the silicone implants, you will see clearly they look at the number of years that the implant is in the body, and you will see after 10, 12 years, the rupture starts to go up significantly high and sometimes exponentially high, such that if I have a patient who calls me and says, I have breast implants, silicone from 1990, I will say 95% chance to 99% chance that you're likely ruptured because they're not meant to be in the body forever. right? And so going back to, there are patients where 1979 saline implants intact, both, to my surprise. You would think they would be ruptured, but these are the outliers. If you go back and look at the literature that the manufacturers themselves have put forth and studies have been done, it clearly shows at the 10, 12-year mark, the rate of rupture starts to go up significantly high. And the reason behind that is this silicone is sitting on the chest with a lot of repeated trauma and being incubated at 98.5 degrees plus minus temperature, and all these reactionary forces where primarily the implant is sitting below the muscle, and now it's subject to all these movements, and where the implant, it starts disintegrating, it starts breaking down, and now what happens is it literally disintegrates and ruptures, as you see the many that occur, especially after the 10, 12, 15-year mark, every side being different and every patient being different.
We've seen a lot of people developing multiple chemical sensitivity or mold hypersensitivity. How many people do you see, and does the explantation address this?
So when you say mold hypersensitivity, it's hard to gauge that. I have talked to a lot of patients. They say, well, I have an active mold infection. And I say to them, well, what proof do you have? Have you had blood cultures? What is this hypersensitivity? Now, other than these three patients, if you look at the chest itself, now, anytime you have a foreign body, be it like a hip implant or a pacemaker, for example, there is susceptibility to infection or to fungal infection. Now, if you look at the chest itself, where the implant is sitting, the chest is not the area where a fungal infection is going to likely occur in the proximity of the silicone. This is not where fungus likes to grow. For example, if you have the nails, a lot of water, or let's say from the gym, you're able to easily pick up on it. The body in itself has a very well-equipped immune system. Fungus will not grow inside the chest in the proximity of the implant on a very common occurrence. It's a very rare phenomenon. And that's why I have not seen, and my mentor, who's been practicing for 42 years, for example, he said, I've not seen mold visually in my practice. Now, the question becomes, has he checked for mold? These three patients, when I was operating, had I not sent the swabs off of the chest. Now, remember, I take the cultures not from within the capsule around the implant. I take it from the chest because ultimately I want to be, if they're positive, treat the patient, because the patient has to be showing these sign symptoms. Remember, if someone has a fungal infection, likely will have fungemia or redness, erythema, tenderness. And remember, so this is very important. We want to confirm, justify with full confidence that this is a fungal infection. Now, I tell my patients, there's three checks technically that I have for patients if they have a fungal infection or not. Number one, I take the cultures from the fungus. If the culture come back, they grow on a petri dish, the swab, and 4 to 6 weeks later, they send me a report on each and every single patient that if this is fungus, yes or not. Number two, remember the capsule in itself is removed 100% of the time, all of it, and sent to the pathologist. And now the pathologist, the MD doctor, is looking at it under the microscope and now looking at figuring out if there is cancer, histiocyte cells, multinucleated cells. And I will tell you, if this doctor sees hyphae or these branch-like structures underneath the microscope, which we all have seen when we were in grade 6, right? He will alert and say, I see fungus. And to date, he has not reported that yet. And number three, grossly, if there is an active fungus, I will see the black around. Now, I have seen gray, dark gray, or dusky appearing matter that is suggestive of fungus. And when the pathologist is looking at the capsule, he or she will be able to definitively rule out fungus, because he will alert me, because that's another check where he's looking for fungus on stains, for example.
Well, I'm thinking about Crystal Hefner, Hugh Hefner's wife, who developed a case of sick building syndrome as a reaction to the Playboy Mansion, which she blamed on toxic mold, but also on her breast implants, and had to go through the surgery and seems to have responded to this very well.
Sure, sure. No, absolutely. Don't get me wrong. This is very, very, I use the word, it is important to rule out. But at least in my practice, a direct association of fungus and implants, I don't see that every other month, for example. It is a relatively rare. Now, I will tell you, I once went to and took care of a patient. He actually moved into a house. There was mold inside, and this gentleman, he actually was living in a house and he did not know that in this new house that he had bought, there was actually an active mold, i.e. fungus infection, a fungal colonization. And then he was breathing the air. And the next thing you know, he ended up getting a lung infection. Now he has no implants, but now all of a sudden he gets the fungal infection and it is in his blood. That's how you get the fungemia, right? Now you can only imagine wherever there is foreign body, be it a hip, pacemaker, lap port, or in this case, a silicone implant, it does not take much for the fungus to deposit around a foreign body. Just like a patient with a prosthetic tricuspid valve, before any dental procedure, you have to take prophylactic antibiotics, right? So in a similar situation, if someone gets a fungemia, it may seed the silicone. Now that has to be worked up by an infectious disease where blood cultures and other a physical exam along with other blood work needs to be done to actively prove that this infection indeed did or does exist, like a bronchoalveolar lavage, for example. And this patient, what was conclusive, where he was literally putting out fungal mucus discharge.
Well, the most prolific fungal infection is Candida albicans,
Yes.
and a lot of people develop oral candidiasis when their immune system is suppressed. Do you routinely see this as people start to descend into implant illness?
Yes. So very good point. I have had a patient, again, someone diabetic will certainly be susceptible. So just this week alone, a patient said, I have oral thrush. Another patient of mine, 895cc implant I removed from this nice patient. She ended up getting a fungal infection right at the crease, at the incisional crease. Now, this is approximately 7 weeks after the fact. Now, this might be just because of she's wearing the bra and the binder, poor hygiene. But remember, if you look at her culture results and the capsules, there is no mention of any fungus there. And on my physical visual exam, the patient did extremely well. Now, it certainly can happen, just like after a paniculitis, someone gets a superficial topical candidal infection, and you treat this with the nystatin powder, for example, and that usually takes care of the problem. So it does indeed occur in patients post-operatively who are immunocompromised or who are set up because they may be diabetics or because of their predisposition to forming these infections.
Thank you for that. We were talking earlier, Eric and I, and, we were trying to think about like, when did all this start? When did breast implants, when did it become popular? And so we were talking about Carol Doda in San Francisco in the 1960s. And that's kind of the person who made it, just trendy, and whatever, I guess people were loving it at that point in time. And we're just curious, like, because from that timeline, for so many years, there were no issues with these implants. And I don't know if the materials are still the same or if they changed or whatever formulation, depending on what decade it was. But all of a sudden, it seemed like in the 90s, people were having problems with these implants and getting sick from it. And I wanted to gauge your history and your knowledge in this arena.
Sure, good question. Now, I will tell you that the problem with the implants, be it saline. Now, let's talk about saline implants. Saline implants, the vast majority, if you hold a saline implant in your hand, the vast majority of what you see on the inside is saline. You can give to a newborn. The outer shell is silicone, right? You would imagine, look at the 1992 ban. right? And this is the irony of the whole situation and very intriguing part. They banned silicone implant. So 1992 onward, if anyone says I have had augmentation, I always tell them you have saline. It's like, how did you know? I said, because the silicone was banned. Under experimental reasons, they allowed for silicone. Now, look at the symptoms. Look what I mentioned like 15 minutes ago. Patients with saline implants, they have the same set of problems that silicone implants patients do. Suicidal ideation, fibromyalgia, all these other symptoms of breast illness. Now, what is unique about this time is now in the 60s and 70s, 80s, this was no social media. No one was doing it at the 60s and 70s at the rate that they were doing it in the 80s, i.e. the augmentation. Now, all of this mountain of evidence from the 80s that occurred and the rate of rupture led to what was a ban of silicone in 1992, right? Now, what you're seeing again is this. In 2007, they reintroduced what was silicone implants, again, safe, good, gummy bear, excuse me. So in 2000, and sorry, these were the sensor lights. So in 2007, they introduced what were the silicone gummy bear safe. Now, as you will see, they have had them in for a period of time. And now you see a surge of these patients who are now starting to get rupture and the breast implant illness. And now this is purely what is purely a social media phenomenon, where now they're talking. In 1970, 80, they were not truly talking. It was more the rheumatologists and the other doctors that basically said, whoa, this is real. Let's go ahead and put a ban. There are a lot of complaints. People are really hurting. So now the patients, interestingly, are the ones who are driving this. If we ask any plastic surgeon in general, and this is the point I made very early on, you asked a very good question. The average plastic surgeon will tell you this is a myth. Breast implant illness is a myth. It doesn't exist. It's true, maybe 2%. Vast majority of the patients actually are very happy with their decision. Absolutely not true, because remember, I said eventually all of them will succumb to breast implant illness because the implant will rupture or will give out the silicon toxicity, and it's only a matter of time. Now, what happened in the 70s and 80s, it truly did translate to in 1992 as a ban. Now, what's interesting is right now you're seeing, look at, you have four groups of people. You have the manufacturers. They're actually advertising and saying they're safe, right? You have the plastic surgeons. They're still saying you cannot even publish breast implant illness in the regular journal at a rate that they're published elsewhere, right? They're not actively, if you will, saying that implants are bad, right? Or highlighting many of the, if, let's say, for example, I go to 10 college students and let's say they want to get implants, or 10 cancer patients. And all of us get on a plane and we go to the top 100 hospitals in the country. The top 100, all of them will be told, you deserve implants. This is a warning that you should be aware of, but here, get him. You deserve the best, and this is good for you. No one's going to tell them, don't put in implants, these are dangerous. And look at all these warning signs. Have you read these? Are you really sure you want to do this? They will all, 20 of them, be getting implants in a heartbeat. And this is the problem and the disconnect. Going back to the four groups of people, the manufacturers are laughing themselves to the bank. The plastic surgeons likewise are being like passively accepting that these are still safe, which they're not. The FDA, unfortunately, is very passively, very softly, politically correct, putting out these warnings that they did 2 years ago, right? That you saw, that we talked about earlier, and then this squamous cell. Do you think they're actively implementing? Look, the textured implants have been banned. Did they tell those patients who have textured implants to get them removed? Imagine you had textured implants and they are banned right now in France and in the US. And all those ladies who have textured implants, I removed textured implants today, for example, where did the FDA let them know or tell them you need to take them out? No, they told them live happily ever after. There is no recall. You just be aware that textured implants are associated with BIALCL. Again, this is what I read in this thing. So now what you have is a fourth group of people, which are the patients. They themselves are taking the responsibility of saying, oh, this is breast implant illness. I am going to go to a plastic surgeon who believes in removing the entire implant and capsule and all inflamed tissue and take the cultures and then send the capsules off and any inflamed tissue, and so I can get my health back. And it is these ladies who are talking to each other through the many Facebook, social media, and now they're overriding their own plastic surgeons, their rheumatologists, their family medicine doctors. These are the doctors, the family medicine doctors, rheumatologists who have not even touched implants in their life, who are now making the decision, well, these are safe, this is what I read. And so the medical literature is not keeping up with it. And now you see this movement of patients who are now taking this medical decision and surgical decision in regards to explanting, because they know their best friend explanted it, did well. You want to hear something unique? I had an 82-year-old patient, 82-year-old patient. She came in, she's a great grandmother. And she's like, I have mental confusion. Now, anyone who listens to the 80-year-old, they're going to say, well, guess what? You're 82. No, she is as sound can be. And unfortunately, the implants are causing her all these problems, along with just the weight of the implants on her neck and back, plus all these symptoms, right? And the point I'm trying to make here is there are patients from all walks of life, the young and the cancer patients and the old and everyone in between, who unfortunately are hurting directly. Now, one thing I just want to mention here is this. What is the proof we're looking at? I want you to see on my Facebook, whenever I removed, for example, a saline implant or a silicone implant, I touch it and there's some fluid around almost always. And if I go like this, you will see the gum sign where you see the silicone, even though the implant is intact. And then what I did was I took one of my patient's saline implants. She had intact saline, and I sent them to Dr. Henry Dijkman in the Netherlands. He took the saline out of these implants and he centrifuged the saline and collected what was a pellet, and he showed under electron microscopy that these were indeed silicon small particles that were slowly leaching from the shell of the saline implant, which was made up of silicone. And this is what is going into the saline and certainly what's going into the rest of the body. We know from Dr. Atul Mehta, who's a Cleveland Clinic pulmonologist. If you go back and look again on my Facebook Live I did with him, that's another Facebook Live that you should see, and everyone else, you will see a publication where he has a patient with intact saline implants, and she had a lung biopsy that showed silicone in her lungs. And clearly, Dr. Mehta proves in his paper, and it is a publication, through a collaboration with Southwestern Medical Center in Dallas, two major hospital systems of the United States, where this silicone under electron microscopy and energy dispersive x-rays clearly showing that this silicone within the lung tissue itself has come from the saline implant, clearly proven, and patient has resolution of the symptoms a year out, given the explantation she had. And again, consistent with that line that says patients have basically complete resolution, quote unquote, of symptoms when the implants are removed. And this is again, now, sometimes I look back at all what I just said and I laugh and I say, are you serious? Do I have to prove? Do I have to show all of this to someone to say that breast implant illness exists? No, it is right there. It is right before us. And history is indeed repeating itself.
I did have two more questions. It sounds like that insert that you had read to us, that's a new addition to the recommendations. Is that true, or? I'm just trying to
That
understand.
that is more or less a translation of what the recommendations were.
Okay.
So yeah, so basically, if you look at, if you go in, and I want my listeners and viewers to do this, go to Google and type in FDA warning recommendation breast implant illness, and you will see clearly those 3 points, and I'm going to highlight them again. If you want, I can pull it up on my cell phone, but you can do it all yourself. Number 1, it says, FDA clearly says, implants are not lifelong devices. They last 10 to 15 years in the body, some sooner. Number 2, breast implants are associated with breast implant associated anaplastic large cell lymphoma. People have died from it. And number 3, that breast implant illness exists, brain fog, fatigue, the rheumatological problems, autoimmune issues, and that if you have these symptoms, seek consultation from a board certified plastic surgeon. These are the 3 points, and I paraphrase them, directly highlighted by the FDA. And I want each and every single listener to fact check whatever I said. You have these publications. These are hard copies. This is not opinions. These are facts which remain undisputed. This is what has been reported by the FDA. So this is not, this is very similar to what the FDA pointed out in October of 2020.
Wow. So this wasn't a standard since the beginning of the invention of breast implants. This is like a new warning
Right.
that they're putting out there.
Absolutely.
So I feel like they've been seeing this progress, and not till this has become explosive and affecting so many people. Now they're saying, okay, now there's a warning. Now this is causing these problems. Now this is an issue. This is insane.
Right or no, absolutely. I like the word insane. Now I will tell you, so I myself, so in September of this year, 2022, the FDA itself put forth another warning and said, medical community, please be aware that breast implants are associated with squamous cell cancer. Now, this is very interesting, squamous cell cancer. I called the FDA myself, and I talked to them, Dr. Corneliuson. She is an MD, PhD, OBGYN doctor, because I asked her, if you're a plastic surgeon or not. And then Dr. Ashar is the one who is the head, who is the one who published that on behalf of the FDA. And there's a whole committee that sits together and puts forth these recommendations. And she's a general surgeon, not a plastic surgeon. And I asked him, it's amusing to me, and I exactly put it like that. It was a 26-minute conversation I had with Dr. Corneliuson. And I said, here you're worried about these 16 patients. Now, it's important to mention 16 patients with squamous cell cancer. And they wanted to alert and say, you know what, if there's 16, there's probably a whole lot more. And I said, here you're worried about 16 patients. Are you not aware that millions of these patients with breast implant illness are hurting, suffering, with all these other problems? Do you not want to put an end to the implants or put them on hold till you figure this out? And she said, well, we have not received complaints. Now, I want you to do this. If you want, I will show to you the FDA has had 350,000 complaints. Now, I'm going to put you on hold here for a second. If you don't mind, please bear with me because this is part of this. So this is, I have my other phone, so I just want to show you this so you basically can see this. And again, I want the patients to do their own look and workup. And this is, again, all present on my Facebook page that I recommend that each one of you. So this is.
Let's see if we can see it.
Yep. This one's.
We really love your passion, Dr. Khan. I wish there were more doctors that were as ethical as you are.
Just 1 second, if you bear with me. So since 2009, all right, so The US FDA administration has received more than 350,000 incident reports involving breast implants, comma, according to a chart shared by the agency. And here I am, and you're going to see this. The title here is FDA kept hundreds of thousands of breast implant incidents hidden from public.
Wow.
And how many are there? 350,000 incident reports. This is official. I'm not making this up. Now, this is where what you said is insane, and I say it's actually amusing that here you have a mountain of evidence versus you have all these patients. And if you all one needs to do is just listen to the patients and you'll get all the answers, because they're telling you, you just go to my Facebook page or you just come to my clinic and you will hear the patients that will speak to you in the masses, and they will tell you that they're hurting. Not only them, their significant others, their sons and daughters, their neighbors, their students, or whoever they might be. And I will say to you and to everyone else who's listening, what is it going to take to put a ban on the implants, right? I mean, what else are you looking for? And I use this example that I used previously. You know, I have a Note 9 right here. I had a Note 7. It would catch on fire. It would literally, Samsung, it would blow up. And so you were not allowed on a plane with these. They would actually announce, if you have a Samsung phone Note 7, you cannot take it because it was a risk. And there was only a few fires, and that was enough to put a ban on these cell phones. You have these millions of patients. Now, there's only 350,000 complaints, so you can only imagine how many more there are, not only in the United States, but all over the world. You had 1.8 million people on Earth in 2017, for example, that got augmented. It's a lot of people, and multiply those over the years, you have so many people who are hurting. And all of Europe, all of South America, all of the North America is in denial, and including the Middle East, that breast implant illness exists, and you have all these patients literally hurting on a day-to-day basis. And you know what's ironic is, when I ask these patients, what % chance do you think you have breast implant illness? You know how many times I hear the word 100%? So this is the disconnect, and this is what, you know, I will tell you, if you can reach another patient who's not going to get augmented because of this podcast or the Zoom call, or another patient who finds out and says, oh, okay, this is the reason why, you know what, that is what I would say is a successful podcast, because we've prevented one more patient from being hurt. And it is a very interesting time of a hurt. There is no lab diagnosis. There is no imaging diagnosis. It is a diagnosis of exclusion, where if a patient comes to me, I tell them, go to your doctor, get the rheumatological workup, get your basic blood workup. If all of that is negative, more and more fingers are going to be pointing towards what is breast implant illness. And implants only hurt the body. No one comes to my clinic and says, oh, the implants are making me more energetic, or I can run farther, or I can concentrate better. If anything, the opposite. Implants are only associated with badness, and they have no place in our society. They have no role in a woman, and they have no role in basically hurting the patient and causing harm. Now, let me just mention one other thing. Why are breast implants bad? And again, I will basically outline them. Number one, they're associated with breast implant illness, the many signs symptoms. They're associated with lymphoma, squamous cell cancer. They're associated with infection. They're associated with capsular contracture. They're associated with rupture, silent rupture. They're associated with a lack of a good physical exam, where you're not going to be able to palpate and feel a small mass, because it was cancer, was undiagnosed, which is the most common way of picking up on a breast cancer, is by a self-monthly breast exam. Or these patients choosing not to get a mammogram because the last time they got a mammogram, they had their implant coat crushed against the machine, for example, right? The next thing, you have patients with the asymmetry. How many patients? You have patients that have literally implants that need to be replaced every so often, where they have pain as a result of the implant and sitting next to the proximity of a nerve. And you have loss of sensation, change of sensation of the chest and the breast. And you have, over time, the implants only bottom out and cause what is skin rashes, amongst others, in the proximity of the nipple areolar complex, with distortion of the chest wall, for example. And again, the other thing, last but not least, if you can imagine, the pectoralis muscle sits on the chest and inserts into the upper arm, the humerus. Now the implant is sitting below the muscle in vast majority of the cases where the surgeons put in. And now what is happening is the muscle is compromised. And so now the upper extremity pectoralis function is compromised. And now the patient is not able to weight lift or exercise, because every time she does, the implant bounces up and down, just like in a male bodybuilder, right? And so that's why the female bodybuilders, they get their implants above. So you have a mechanical compromise of movement of the arm as a result, because every time the patient uses the upper arm, it's going to press against the implant and the patient feels awkward. So small activities like holding a grandchild, for example, can be bothersome. Plus just the mechanical effect of having the implant on the chest, heavy objects with the neck and back pain. So again, look, the evidence is massive. There is anyone who listens to this should not even think about augmenting.
Thank you so much, Dr. Khan. I really appreciate your passion, your honesty, and really being an advocate for these people who are falling ill. And it's just astounding to me that, out of 8,000 surgeons, that you're kind of the only one really speaking out about this. Like, you're a lone warrior here. And I do appreciate that, because so many doctors and so many levels. And I feel like breast implant illness is kind of parallel with what we deal with, mold illness. So many doctors just pretend like it's not a thing, and nothing's going on. CDC and everyone's like, oh, it just causes an allergy in this, but we're seeing an explosion of issues. So we really do appreciate your presence on our show and agreeing to come on and talk about this. If any of our listeners want to find you, where can they, where can they find you? If they want to look you up.
So as you mentioned initially, I just want to mention two things just to kind of complete and finalize. All my patients have said two things after explantation. Number one, they wish they had never augmented. Number one, and I tell them it's not your fault because the system told you that they're safe. And number two, they wish they had explanted sooner, such that they would have gotten their life back and they would have had their meaningful lives return. I will tell you, and I say this very humbly, from a financial perspective, whenever augmentation, I said earlier, takes 1 hour on average. So it is not uncommon for plastic surgeons to do 4 to 6, up to 8 in a day that I've seen. One of my friends did 8 between 2 operating rooms. Now, it takes me 4 hours to explant. Like today, I was supposed to do this interview with you at 4 o'clock with a 2-hour buffer, right? And I ran into my case and I finished 2 cases alone at 4 p.m. and I was here at 6:15 in the morning. And the point I'm trying to make here is I had a 750cc implant on a nice lady that came all the way from out of state. And another patient with textured implants, and she was very, very much hurting. Now, the surgery is a very serious surgery. The surgeon has to be fixated that the entire implant capsule plus all inflamed tissue must be removed, and the capsule must be sent, because if you're not sending the capsule, you cannot look at the capsule and say if there is cancer or not, if there is mold or not. We have to rule it out such that we know with certainty that it was not this, it was not cancer, it was not mold, right? And so that is very, very, very important. And I wish, hopefully with these talks, and hopefully, ultimately it is my firm belief, no plastic surgeon or the plastic surgeon community is not going to say, okay, we're going to stop augmenting and we're going to only explant and we're going to do this right. Look, they're already calling this a myth. There are surgeons, and I've gotten a lot of quote negative feedback from the community. And you know what? I will say this to them and to anyone who's listening. I say, don't listen to me, listen to my patients. I'm helping them, I'm benefiting them. One of my friends, who's a very good friend, who's a well-wisher, he called me up and he said, Khan, what you're doing is pretty dangerous. I said, tell me, because what you're saying is very concerning to me. He said, you're talking about removal of implants. You have this following on Facebook and on social media. And I said, all what I'm doing is removing the implant and removing the capsule, and I'm taking cultures, and I'm doing it in a very safe manner where 99% of my practice is removal of implants, and I'm ensuring removal of complete capsule. If someone has BIALCL, what is the requirement? If it is not removed, it is malpractice. The requirement is to remove all of the capsule. You don't want to send off half of the capsule. There's actually, I was reviewing a case where part of the capsule was sent and it came back as BILCL, and now that patient has to go back and remove the rest of the capsule. And remember, this is where we know clearly those patients who have had just the implants removed, they have had to go back for a second surgery to remove the residual capsule, because if that capsule is not removed, the patient is not getting better and healthy and freedom from the breast implant illness. And so that is the most important part of the surgeon has to believe that breast implant illness is real, and the capsule and implant plus all inflamed tissue. And I will tell you, if a surgeon is augmenting, he cannot be believing in breast implant illness, because why would you knowingly put in implants and be also taking them out? Because you're only ultimately going to be hurting, like that 22-year-old patient who at day 29 had to get her explant. No, I thank you very much. I tell my patients, do your homework. Sometimes just talking to a surgeon, listening to a podcast like this should give you enough mountain of evidence. And I say to each one of my listeners and viewers, go to my Facebook page, look up Dr. Atul Mehta, MEHTA, from the Cleveland Clinic, his publication, Dr. Henry Dykman. This in itself is the proof. The manufacturer, this is the company that makes the implants that's telling you the bad detrimental effects of the implants. Get into a discussion, go on a listening tour, listen to the patients. And when you listen to the patients, you'll be convinced without a doubt that implants are bad and they need to be taken out in a very defined, sophisticated way, such that when the surgery is done, you have full confidence that your surgeon did the right surgery. And this is what I say, that the patient should have the peace of mind that the surgery was done right. You don't want to be post-operatively thinking if something was left behind or not, because you don't want to be second guessing your surgeon or yourself. So please go to Executive Plastic Surgery. My name is Dr. Shaher Khan, Khan, and you will only find me as far as the explant surgeon. And I recommend my patients to go seek other plastic surgeons. Sometimes if the irony of the situation is, if you go to 10 different explant surgeons, you're going to get 10 different answers. And sometimes within their own practices, some surgeons choose to do the more sick patients in a different, quick way versus the young, healthier ones. So for example, 9 days ago, I did a patient at the hospital. She had stents in her heart and open heart surgery in the same manner that I do my 25-year-old patient. And so all patients deserve the best. So I go to my YouTube channel, my Facebook, and my Facebook lives that I have done, such that you can be an informed patient and a better patient, and your significant other and your family can certainly listen in as well, so that they're well aware as to what you're going through. Because people say you're stressed out or crazy or you're making this up. No, it is a real problem. Just like the 82-year-old lady she came in because she had a defined problem.
Absolutely. And thank you so much for helping these people and just validating how they feel and just letting them know this is a real thing. And here's the proof. So thanks again, Dr. Khan, and to all of our listeners, we appreciate you and we hope you have a wonderful day.
Thank you very much. It was a pleasure to be on, and thank you very much for your time.